one of the things I do to add value in my clinic, actually I do a number of different things, but one of the very first things I do is I make all patients go online, and they have to give me their name and email. In order to get access to my patient questionnaires, they have to give me their name and email, and then we have it on autopilot, where we have a software program that automatically sends out our questionnaire to patients once they have given us their email. And so then they get this 14-page questionnaire that they can print out and they can fill out at home. And the reason why we use, there's a couple reasons why we use lengthy questionnaires. One, it shows higher perceived value of our services because we're willing to ask so many different questions about that condition of our patient. They are already seeing a higher perceived value in what we're doing, because very few doctors will go through the trouble of doing this. And I've talked to a lot of doctors, and they say, well, my patients don't want to fill out a 14-page questionnaire. It's not about what your patient wants, it's about what they perceive and the confidence and the value that you're going to provide. And so a 14-page questionnaire is a good start to starting off that relationship on the right foot. The other reason I like to use an extensive questionnaire is to be able to get as much information about that person initially as I possibly can. And that way, when I walk in the room to examine them, I already know 14 pages worth of medical history, so I can talk to them a lot about their condition before they've even talked to me. It just sets the stage off for a greater degree of confidence on my end and for a higher perceived value on the patient's end. So remember the psychology of where your patients are by the time they actually find you. If you're practicing functional medicine, you're probably not the first doctor they come to. Most people who seek out functional medicine doctors aren't doing so because they heard functional medicine and they want to go find a functional medicine doctor. They're doing so because they've been to several specialists and other experts who practice the mainstream model, and nothing has worked. These people are at the end of their wits. The drugs that they've been prescribed don't do a whole lot. The doctors that they've talked to don't really have a whole lot of solid answers. The patient's confused. They're starting to lose hope. And they're in your office because psychologically, you're their last hope. I can't tell you how many times I've heard patients tell me that, Doctor, you're my last hope. I don't know what I'm going to do. If I didn't find your office, I wouldn't know where I would be. I would just be at home, miserable. I'm so glad I found you. So remember where your patients are when they're coming in to see you. They're coming in after being completely discombobulated by a medical care system that just doesn't work very well for them. So they're out of traditional options, and they're very motivated to take action on non-traditional options, i.e. functional medicine. And this is where your job comes in. It's your job to help them understand that functional medicine is what they need. If they don't comply, it is either your fault for not delivering value as you educate them, or it's your fault for failing to communicate the value to them. And this is where, again, I talked earlier about the triangle of health and how using the triangle of health oftentimes is one of the main components that helps the patient understand the value of what you do. Because if you can explain that triangle, nobody else has explained anything anywhere near that makes any sense to them. And so when they hear that it makes sense, they're ready to do something that makes sense because they've been doing so many things that don't make sense and haven't helped. And so this diagram is just what I use when I'm educating my patients. I actually draw the diagram out for every patient on a new examination. When we go in the room after we're done talking, kind of the way I break it down to them is, how much do you know about functional medicine? They usually don't know a whole lot. They just know that it's different. And so then I explain to them that I am going to talk to them a little bit about what functional medicine is and how it's different and what they need to understand about the way I operate. Because if they understand the way I operate, they're going to have a high perceived value of what we're about to do, because what we do is extremely valuable. So I use a lot of visuals when I'm educating as well. That diagram that I just showed you on the triangle of health is one of the visuals I like to use, and I like to draw it out. And some of the other visuals I use are listed here. I have a whole array of different visuals on marketfunctionalmedicine.com that you can tap into if you want to see examples. These are visuals. These are easy to make. I sometimes hire graphic artists to put these together for me based on conceptual ideas. But these are things that help get patients to comply, because when they can see it and they can understand it, they're going to follow your orders a lot more aggressively as opposed to not. If they don't understand what you're trying to explain to them, if they don't understand what you're trying to accomplish with them, then your compliance is going to drop. And so, again, when compliance drops, the patient doesn't get better. When the patient doesn't get better, they don't refer. When they don't refer, your business doesn't grow, and they're not out there advertising for you. So as much as you can use visuals in your office to help educate your patients, very, very important concept to tap into. I also provide a lot of educational handouts. This is an example of a handout I use on iodine. We test a lot of patients with thyroid disease with using something called an iodine loading test. And so if their results come back and they are iodine deficient, I want them to know a little bit more about how iodine is affected. And so this is one of the handouts that I use that they can take home. And that way I can verbalize it to them in the office, and they have something they can actually take out of the office and read when they get home as well. We also take these same concepts, so, patient forms, patient educational materials, graphics that they can look at, and we put them online, and we put them online where patients can access them as well, and we also email them on a regular basis to our patients. So this is where we get into educating. So far we've talked about unique selling proposition, we've talked about perception of value, we've talked about educating patients to a certain extent. Now we're going to talk about leveraging education. Leveraging education is something that can be done because you can't spend an hour with every patient that you have. You have to have a way to leverage your time so that you're still capable of educating your patients on a regular basis, even when you're not present. And so this is a flow that I use in my own office, and it works extremely well. And so if you look at the left-hand side of this diagram, you've got the patient's initial visit. And remember what I said earlier, is that we have all of our patients fill out to get the questionnaires so that they can use and fill out our questionnaire, our new patient questionnaire. They have to give their name and email address. And so we follow up, email them the questionnaire. And we also follow up, email them a customer service feedback form that allows them to give us information, allows them to give me information about how well my staff is doing, about how well my customer service was. But that initial patient visit, we identify their health concerns, and we identify what it is that they're there to be treated for, obviously. And once we have that knowledge, I can now take that knowledge and I can send information that will be helpful educating that patient to that patient via email. And the way I've done this in my office is I've got several email educational pieces that I've written that are topic specific. So some of them are related to gluten, some of them are related to thyroid and rheumatoid arthritis, some of them are related to degenerative disc disease. There's a lot of different sequence pieces that I've written. And so depending on a patient's problem, I can have my staff plug that patient in to an email responder that starts sending them educational pieces on information that I know is going to be helpful and valuable for that patient. And so that process is going to lead to an educated patient. So when they come into the office, it's going to reduce the quantity of time I have to spend explaining something to them, because if they're getting and reading the emails, they're going to get a lot of their answers, or a lot of their questions pre-answered before they come into the office. And so it saves me time in the office, but it's also greatly appreciated by those patients. They're thankful because it's an extra value-added service that we can give them that nobody else is giving them. And so it increases their loyalty to our office because they learn a lot about how to manage and help their own conditions just by email sequences that we pre-write. The work for this type of the work for this type of thing initially is big. So you would want to write, for example, if you treated a lot of thyroid disease, you might consider writing 4 or 5 educational pieces on natural treatment for thyroid, things that you focus on in your office, whether it be avoiding halide elements like bromine and fluoride, whether it be making sure that you're educating your patient about the nutritional implications on hypothyroidism, like having adequate selenium for conversion of T4 to T3, or having adequate magnesium for thyroid stimulating hormones to activate in order properly. So these are ideas of educational pieces you could write to educate that patient so that they know how important nutrition is to their condition. And so again, what you're doing is not only you're giving them value after you see them initially, but you're pre-selling them on all your follow-up care because they're getting all this great information about what they can and should be doing about their condition. And when they come into your office, they've heard it once, maybe twice, maybe 3 times, depending on how many emails they've received and how many emails you've written them and how many emails they've read. And a lot of it is going to be repetitive information. Remember, education is about repeating the same thing over and over again until something sticks, right? So we want to put this part, we want to use our knowledge, we want to put it to paper, we want to put it to video, we want to put it to the internet in the form of a blog post, and we want to automate that process so that the patient receives this information based on their problem and they can get educated repetitively. And again, that's going to create a higher perceived value of your services, and it's going to pre-sell the patient on the care that you're probably going to be prescribing to them on